Welcome to Heartline, conversations with healthcare changemakers following their heartline. I'm your host, Dr. Andrea Austin. I'm an emergency medicine physician, coach, and educator. I believe that healthcare needs to improve the quality care that patients receive, and that supporting the workers is at the heart of this transformation. I am so excited to be with Josh Sarkis, Chief Strategy Officer for PharmaSmart. And we are here at this amazing Health Innovators Conference that I'll be sure to link to in the show notes. The energy here is just phenomenal. And if there's a little background noise, it's because we're here at the conference. So Josh, welcome to the podcast.
Thank you. Thanks for having me.
Well, we always like to start off with what is your Health Innovators journey?
Personally?
Yes.
So I've been a business owner since 1990, starting out with my brother. Don't tap. And we bootstrapped a small company. We were distributors for a manufacturer that made blood pressure kiosk devices. And we would put them in pharmacies across Canada and the United States. And back in the 90s, when there was a lot of independent pharmacies, a lot of smaller chains, and they were willing to work with a couple 23-year-old guys that were driving around in trucks with these machines, and we would sign lease agreements door to door. And then it went from there. We started to get larger accounts, larger chains, but we were buying these machines from a manufacturer, so we were a distributor. So that's where we learned the business. Then, as often happens, the manufacturer sort of turned on their distributors and decided they didn't need them. So this would be my pivotal moment when we had to either get out of the business or double down. So we decided we had enough customers, this is about 10 years in, that trusted us and believed in us that we could start our own device company, build out some patents of our own, and improve the clinical validity, especially of the blood pressure. And that's what we did. So we ended up with a patented cuff design and an approach to blood pressure monitoring that's clinically validated, first of its kind for a self-use kiosk device. And that's led to some new business opportunities for us.
Well, this is very exciting. So I'm looking at a picture of this kiosk. And I remember, actually, in my hometown, maybe you sold a blood pressure machine in Vinton, Iowa at LaGrange Pharmacy. I don't know. Yeah. But you walk in, you could sit down and get your blood pressure checked. This kiosk that I'm seeing the photo of, is this meant for like home use? Would this be in someone's house, or is that like a doctor's office? Where will these be at, or that they're at right now?
Yeah. So like your experience in the pharmacy, there's that application. That's an important one. That's where we come out of that industry. So they're meant, it's one blood pressure machine for 10,000 people instead of one blood pressure in every home, which is not a bad idea either. But this is accessible. Pharmacies traditionally do this to improve the conversation about healthcare with their patients, improve compliance with blood pressure medications, get a conversation started about risk factors, all that. Traditionally, that's what's done. But what made us different was we came in with a device that was clinically validated. A lot of these other machines, and maybe the one you used in Iowa, we would consider recreational. In other words, you would never diagnose based on that reading. Yeah. It's not necessarily trustworthy data. So we came in and with evidence and good investment in the R&D, it's a blood pressure result that can be used to diagnose and actually manage medication and control blood pressure over time. So we put them in pharmacies, work sites, but the reason we're here is because we're expanding a new vertical, and that's hospitals and clinics. So we've got a version of this device that's designed and ideally suited to support patient throughput. In other words, a patient checks into the clinic, they go to the kiosk, they get their weight and their blood pressure, clinically validated blood pressure, automated. It can go straight into the electronic medical record. And by the time they're roomed, you've handled blood pressure, you've handled weight, it's already in the EMR, and you're creating more time for the MA and the nurses to have a face-to-face conversation, free up more time for better quality healthcare delivery. So we're seeing really rapid uptake in that side of our business.
It makes so much sense to me because I'm an emergency physician, and I mean, the demand signal for emergency medicine is absolutely astronomical, and we're only projected to see even more emergency visits, and we're overcrowded, we're understaffed, and I don't see that changing much in the next 10 years. So I could really see this instead of one of my techs that, is doing a blood pressure. We need them to be putting on a splint or checking on that patient that needs help going to the restroom, not doing this. So I hope to see these lined up in our emergency department. And aside from, so it does blood pressure, does it do the rest of the vital signs?
So it does weight. I know there's other vital signs, and we're getting a lot of questions about temperature.
Yep.
And these basics that you guys require.
Yeah.
So we're looking at more vitals, obviously not invasive vitals.
Right.
We're not going to get into other things because this is self-use. But temperature would be a good one. Blood oxygen is something that we could do.
Yeah.
That seems to be the scope of it at this point. We're also looking at, this is a giant, essentially an iPad, right? So are there SDOH type questions that we can be asking people, or can we ask about immunizations or mental health? So anything that's patient reported or any questions, intake questions, we can start to handle those on the touchscreen monitor potentially. And using AI, of course, to help speed that process.
Yeah, we need this because it never makes sense to me to have a highly educated nurse asking very basic questions. And the amount of questions that have been added to triage, and they're all with like good intentions behind them, but they take too much time.
Yeah.
And, I look at it takes sometimes 10 minutes to triage a patient. And depending on what time of day we're dealing with, we're getting, 20, 30 people checking in an hour. And the bottleneck. And then the consequence of that is there could be some people that are truly quite critically ill that are checking in, and the nurse is distracted asking, these very basic questions.
Totally understand. So I've been in an emergency room. My son plays a lot of sports, so I frequent the emergency room, and I've seen how overwhelmed they are. And so I get a little bit of experience what you're dealing with. So every minute counts, right?
Yes.
So, and blood pressure is one of these things that we've been measuring blood pressure for 110 years or something, and we're still taking a cuff, wrapping it around, right? Yeah. Some cases actually inflating the bulb. I'm not sure how you guys are doing it. Probably the automated ones that are on the rolling thing. But it's time consuming.
Yes.
And people know how to put their arm through a cuff and press a button. And they're also, in a lot of cases, they're learning. Like that taking their own blood pressure is an act of self-empowerment.
Yes.
They're curious about their result. And they're going to have a question potentially about their blood pressure. And I can't tell you, being in this business 30 years, how many people are in denial about their blood pressure status. Yeah. They're scared to even look at the numbers. And that's where, if they come and you already have the numbers and they've done it themselves, they're ready. They're more prepared for that honest conversation about, obviously, what it means to have high blood pressure, because it's deadly.
So when I'm looking at the machine, they put their arm in, and regardless of how big or small their arm is, it automatically sizes correctly.
I'm glad you asked this question because I'm a total nerd on this, and it's our patent. But our biggest challenge was, because to get accurate blood pressure, traditionally you need a small cuff. Yeah. It's narrower. The medium cuff is a little wider, and then the large cuff is very wide. And there's a reason physiologically that it's done that way, and it's hydrodynamics and all that engineering stuff. But there is a reason that these cuff widths have to be different in accordance with the circumference of the arm. And of course, a lot of obese arms are shaped. They're not straight. They're cone shaped. I'm sure you've experienced this problem wrapping a cuff around a cone shaped arm. Yeah. So we've studied, we had to become experts in this. Like, what's the optimal cuff? how can we have one cuff that's accurate for all patients, not 3 or 4 cuffs? And we did accomplish it. So it's accurate on all adult arm sizes, from the small elderly arm to the very large muscular or the large cone-shaped obese arm. It accommodates them all. And the clinical studies have proven that it's accurate for all those arm sizes, a single cuff, not 4. So that's really one of our breakthroughs. That's the medical piece of it. And the other part of it is, of course, there's a lot of work into the design, the workflow, making them comfortable, making sure we're capturing the data that our customer requires. So it could be a pharmacy. It's very different from a hospital, very different from a work site. But we sit down with every client, large and small. What is the user experience you're looking for? And we design it that way. Do you want 1 blood pressure, 2 blood pressures? If the first blood pressure is high, do you want a retake? These can all be automated in the kiosk. And of course, we collect the weight. We can do BMI if that's what you want. They enter their height and you get a BMI. And then there's a printout, which in some cases, if they're not able to do the EMR integration, they still have a printout for the staff. So there's a lot of technology, and on the back end, as much as on the front end, of course, we have cloud services. We have reporting for businesses on how much it's being utilized, what the blood pressures look like, stratified. We also have the consumer part. So in our pharmacy retail portion, you can put in your mobile number, your email address, and you can start your own little account. You can have all your blood pressure on your phone and your weight. And of course, these pharmacy retailers, who are now healthcare providers in a way, they can communicate with those patients on that platform about their blood pressure. They can talk about clinical services that they're offering at the pharmacy. So the patient engagement piece is also a big part of this, especially with our pharmacy customers.
Sometimes we need to take a blood pressure in both arms. Does it work regardless of which arm?
I didn't even prep you for this. That's incredible. So because we've been in this business so long, we know that. So this cuff can slide to the other side and we can get a right arm blood pressure measurement quite easily. It's
Awesome.
Designed for that. The other use case there is sometimes people have a stent.
Correct.
You probably know, and their left arm can't be compressed. So for those patients, we can move it to the right side. And then the third application there is if someone comes in a wheelchair, they can use it from the side. But you'll see in this configuration, it would be right arm only. We can slide it over and the wheelchair patient can get a left arm measurement. It's designed to accommodate that too.
I love that. The other thought I had is, what about the cleaning? Is it self-clean, or are you relying on staff to wipe it down in between patients?
Every organization has their own rules about this.
Right.
But it does not. So there would have to be, if there is a strong rule about that, we have to work with each deployer and determine what actions need to be taken by the staff to meet that requirement. That's right. Yeah. We haven't had a lot of challenges. Of course, in pharmacy, I think our network is doing 15 million blood pressure readings a year. Doesn't seem to be a vector, but now we're moving more into hospitals. Of course, there's different concerns there. So I guess the answer is we work with each team and make sure we're compliant with their rules around cleanliness and obviously disease vectors and how to control that.
Now, I was always taught that you're supposed to put the blood pressure cuff on skin, not on clothing. What's the guidance on that? What's the data show? Yeah.
So the data for oscillometric blood pressure. So there's 2 types of measurement. It's auscultatory is what you're taught with the stethoscope.
Yep.
You need to hear the beats.
I'm old enough. I remember doing those.
So you're trained in that. It's hard to do, really hard to do. And it's a skill that a lot of people lose over time. Plus hearing becomes an issue.
Yep.
And the cuff becomes an issue and the stethoscope. So there's a lot of oscillometry bypasses all of that. It just senses air pressure changes and it creates a waveform. And then the waveform goes into a computer and it sort of uses that based on thousands of pieces of data to estimate what your actual blood pressure is. So there's no microphone. The bottom line being you can measure over a light. There's no difference in validity, bare arm versus over a shirt. No difference at all.
That is so good to know. I I love that.
Yeah.
That's exactly why I love doing
honestly
this
true
podcast.
with your oscillometric units that you roll around.
Yep.
You don't have to worry about those shirts, right?
Great.
Cable knit sweater, problem, right?
Yeah.
Big jacket,
big
problem.
sweatshirt.
But
Yeah.
when I'm saying one shirt,
Okay.
not a problem.
That's very helpful to know. The other question I have is, the way I've watched the automated blood pressure cuffs work in the emergency room is they tend to go very tight and to a very high number the first time. And, I've had my blood pressure taken and, I felt the squeeze, and sometimes it is uncomfortable. And I think, there's other reasons people may be super sensitive to that when they're coming to the emergency department. Does yours really vice grip squeeze down the first time?
Good. That's another great question. So I can't speak for all patients because this sense of what's painful is obviously patient to patient, but
Absolutely.
We have really good results. This really wide, soft, cone-shaped cuff. A lot of that I think is because the cuffs are narrow. So it's really the fit of the cuff becomes a problem, and that's why the machine, if it's not sensing that the pulse has stopped, because it has to occlude the artery to where there's no pulse, right? So that's where the cuff design comes in. If it can occlude the artery in a less painful way or a less restrictive way, it has less pain. So this is where we think we have an advantage on the cuff, and this is especially true with like I say, these cone-shaped arms. I think a lot of the patients with the different shaped arms, they have more pain. We have a cone-shaped cuff. We have the way that cuff fills with air and occludes is more gentle on the arm. That's what I'm saying. So I'm not going to guarantee that no one will ever complain. You do have to stop the blood flow to get an accurate blood pressure reading. But there's good ways to do it and not so good ways to do it.
Yeah. Fascinating. Well, I'm sure we have some listeners that are, interested in being entrepreneurs. What's your top piece of advice for somebody that is really intrigued by what you're doing and is trying to move in that direction?
So where we had success and was not, number one, not giving up, because there were many times in our career as a company, and in my personal career, where things look pretty bleak. Whether it's your supplier who turns on you, decides they would rather take your business than collaborate with you, or whether it's a customer that feels like you don't have their best interests in mind. Stay patient. Let the customer lead your decisions and make sure you involve them. Always be listening. You're here right now. You're telling me about your problems, challenges in your daily practice. So my instinct is to really listen to that and think, how do we apply those problems when we're coming up? This is not rocket science, but when we come up with our ideas for what we're going to put out next, how do we really listen and how do we really address those problems in the most cost-effective way? So we've had success there, and every question you asked was a question we've had before, and we've built it into the design of our deliverable, right? So I think that applies to any industry. So as long as you don't run out of money, always be listening and always be willing to change, right? Because things are changing really rapidly. The rate of changes is increasing. I'm sure you know what I mean.
Oh, 100%.
From the 90s till now, things are changing year over year now. It used to be every 5 years. So it's challenging. So you got to sit down with your team and say, we can't change everything at once or we're going to go out of business. So you really have to think, prioritize what you're going to do and make sure you're super connected to the market when you're making these decisions. And sometimes you can only do one thing at a time. You got to be aware of what you're spending. And any small business person trying to make it, do not overspend and do not overborrow, right? That'll take you right out of the industry. So make very strategic decisions, go for the low-hanging fruit, one change at a time, and stay connected to the customer. That's what I would suggest.
That is such wonderful, wonderful advice.
Yeah.
Yeah.
And, unless you're a startup and that's a different mentality. But if you want to get to a place where you're actually cash positive, you have to be very conservative in your decision making. But your customers will understand that, I think. depending on your market segment. But I think there's still room for companies that grow organically and don't just burn through cash and then disappear. Because I think that's happening a lot in healthcare right now. And a lot of these great ideas never get to see the light of day because they try to do everything at once. Does that make sense?
That makes total sense.
Yeah.
I really, really like how you've crystallized some key concepts for the listeners. What are your, I know this is such like a big question. What are your top prediction or trend you think people should be watching in 2025?
Well, I can speak to only my experience. I can speak to what's happening in pharmacy. Their pharmacies are closing across the country. There's probably where the PBM challenge is, and there's no reimbursement anymore for pharmacies dispensing medications. They're having a hard time billing for clinical services. We think there's a role for them, and we're interested to see where, like brick and mortar, like community healthcare, like not the hospital, but you're seeing more investment by hospitals into like community outreach, using people in the field, more access to healthcare in the community, in rural areas. What's going to replace the community pharmacy? Something is going to come out of this. It can't just be a giant desert, right?
I hope not.
And two hot corporate hospitals like Coke and Pepsi and two insurers. I think that's going to be lethal. I don't think it helps the healthcare in the United States, and it's just less options for people. And I know I'm preaching to the choir, but chronic diseases is what needs to be dealt with. And I think that's best dealt with more at the street level, right?
Yes.
We got to get out in front of it. So
Yes.
Primary care, but not just primary care, but pharmacists and RNs and nurses. How do we get more face time for people to have access to people to help them before the stroke, right? Or before they get the full-blown type 2 diabetes. We need solutions on people living healthier lives and actually having a health coach in these areas, in these communities that can't afford it or don't have the coverage. Something has to change because it's not sustainable. But that's where we think, in our little corner, we think we can help with automation, right? A lot of these repetitive tasks are just become a burden, and they increase the cost of delivering healthcare. So we'd like to be part of the solution in democratizing healthcare, lowering the cost for this preventative care.
Well, Josh, this has been such a really intriguing conversation. Thank you so much for being on the podcast. How can our listeners learn more about PharmaSmart and connect with you?
First place is pharmasmart.com. You can check out the product, give us a call. We're really excited to work with hospital systems, physician groups, clinics. This is a super high growth area for us, and we want your ideas. That's what I would say. So if something about this conversation rang a bell for you and you're trying to run a busy clinic, give us a call. We want to partner with you and pilot and help solve problems with you.
Awesome. And any other conferences that you would recommend for health innovators, tech people?
Well, we're finding this one to be really, really positive. And we're like you, I think we're looking for more. So I don't have a recommendation other than the health conference.
Well, I'm going to say, how about this one in Europe? I mean, if it's this cool and then head to Europe.
Yeah.
Well, it's been awesome meeting with you, Josh, and look forward to sharing your device with our listeners.
You bet. It was fun meeting you too. Thanks for the time.
Thanks for listening to Heartline, conversations with healthcare changemakers following their heartlines. I'd so appreciate it if you could take a quick moment and hit the like button and also the subscribe button that you'll find within your podcast app or platform that you're listening on. It also really helps if you can leave a review. I would certainly appreciate a 5-star review and a few comments about what you liked about this podcast. Don't forget, you can also forward this to people in your network. People love getting new podcasts and changing up what they're listening to. So sending a podcast to a friend or colleague, or even to start a conversation about a change that needs to happen in your organization, is a great way to be a change maker. This podcast represents the views of the host and guests. It does not represent the views of any entity we work for or with. It is also for informational use only and does not replace any professional advice, including medical or psychological. If you are interested in unlocking your true potential, reach out to me. If you're an organization interested in supporting the well-being of your people, I'd love to connect on innovative solutions. Schedule a strategy session at AndreaAustinMD.com. Sound editing services are provided by Better Podcasting Services, and you can find their website at betterpodcastingservices.com. And I'd also like to thank our future Dr. Caitlin Din, who is the production assistant for this podcast.